State Chamber of Oklahoma's Business Roundtable, presented by Cox Communications. And now, here's your host, Fred Morgan.
Hello, and welcome to the State Chamber of Oklahoma's Business Roundtable. We have partnered with Cox Communications to tell stories about businesses in Oklahoma and discuss business issues. One of the big issues for business in general is healthcare. It is important as an economic force in our state, but it's also important to the businesses and their employees. Today we have, there was a lot talked about in the last session. We're going to talk today with Chuck Spicer, who's the CEO of OU Medicine. Chuck, welcome to the show.
I'm glad to be here, Fred. Thank you for having me.
So tell our viewers a little bit about your background and your family and your hobbies.
Well, I hope we could do this interview in the driveway since you live across the street from me. It would have been a lot more convenient. But again, glad to be here. Originally from Texas, so been in Oklahoma for about almost 13 years. Grew up, actually it's a funny story in terms of my role now. I grew up a huge University of Texas fan. Went to college at Baylor, and now I'm the CEO at OU Medicine, so I'm a heavily conflicted guy. But I have a son that's a freshman at OU, who also grew up a big Texas fan. A second child that's a junior at Cassidy. My wife Amy and I live across the street from you with our two dogs. One of them is part horse. So
Yes, it is.
Bowie. So, but I'm glad to be in Oklahoma. It's been a great place to raise my children.
Well, I'm glad to have you on the show. Healthcare is a really big issue. I think for a lot of viewers, they see the OU Medical Center. Tell us about that. Tell us what the center is, who operates it, and kind of inform the public about what you do.
Okay, we're the most diverse healthcare system in the state. Oklahoma OU Medical System, which is OU Medical Center, the Children's Hospital, OU Medical Center Edmond. We are a part owner of Valor Rehabilitation Hospital, and we have approximately 24 primary care or imaging access points across the metro. So there's a lot more to it than just the downtown campus, although the downtown campus of Children's and OUMC is what people know. 4,000 employees, 400 of those we're hiring over the next 90 days, so we're really ramping up our services. Proud to be the only level 1 trauma center in the state. Proud to be the most comprehensive cancer center in the state, the only freestanding children's hospital in the state, and frankly, one of the safety nets for the state. We provide services that most can't or don't provide, and to every county in the state of Oklahoma and every state in the United States, actually.
You know, you talked a little bit about a level 1 trauma center. I actually worked on that in the past. What does that mean for Oklahoma?
In-house trauma capabilities 24/7 with in-house surgeons. We have it for pediatrics as well, so it's adult and pediatrics. We are equipped to handle any trauma, any time of day, and we have resources that we put in place, whether it's anesthesia coverage, ICU coverage, or surgical coverage that will allow us to do that. And it's a level 1 trauma designation is through the American College of Surgeons. So it's a very rigorous process to get accredited by the ACS.
And it's important to have one in your, at least one in your state.
And we're the only one in the state. And again, it speaks to the essentiality of our services. And if we did not have level 1 trauma, if we did not have the children's hospital that we have, if we did not have the cancer services we have, in many cases, families would have to leave the state, which is an economic drain out of the state, which again is why we want to tell that story of not only are they essential services, but they are economic drivers.
Yeah, let's talk a little bit about that. The center has a tremendous economic impact both on the Oklahoma City metro area, but also on the state as a whole, doesn't it?
I believe that we generate over $1 billion in net revenues a year. We employ currently about 3,500 employees. That's growing to 4,000. The OU Medicine enterprise, which includes the Health Science Center and OU Physicians, employs 12,000 people combined. The second largest employer in the metro. And, we have 1,000 medical providers. Again, the largest group of concentrated medical providers on the campus. So we think there's a lot of different economic drivers that creates. Training the next generation of doctors that we need in this state. We don't train enough of them. So I think our economic tentacles are pretty out there and distributed well, but maybe not as understood as they need to be.
Okay. We need to take a break. We're going to come back as we continue our visit with Chuck Spicer, the CEO of OU Medical System. Come back and join us. Welcome back to our visit with Chuck Spicer. Chuck, before the break, we were talking about all the things that this center does, and it's very extensive. And it's also, you have a lot of people who not only from Oklahoma who come to this center, but people from all over the country.
Correct. We're proud of the services we've grown, do attract patients from across the country. Our neurosciences, our neurosurgical programs, our cancer programs, our children's programs. We have patients in the hospital today. As a matter of fact, the hospital today is 110% full, so a lot of demand for our services. But we have a recent story of a mom from Florida that had a brain tumor that was told is inoperable. Did the internet search and found one of our neurosurgeons, Mike Shagru, came here and took the tumor out. Now she can go raise her family.
Oh, that's wonderful.
So it's a good story.
Yeah. And if OU Medical Center did not exist, where would the people of Oklahoma get care?
Well, some of it could be absorbed by community hospitals. We have some great hospitals in our state and our city, but there are services that, like complex neurosurgery, some of the complex cancer treatments, a lot of the pediatric services, they would have to go out of state. And for a kid that has to go out of state, it's more than just a child, obviously. It's mom and dad that are having to take off work and leave to go to Dallas or Houston or Denver. And that happened 20 years ago. That was what was happening. And sometimes that affects a family's decision to relocate.
Right.
And so I think it's a critical issue for not just our families, but for our economic infrastructure, our corporate citizens, to have those services available in our state so their employees don't have to leave.
So a lot of turmoil in the healthcare world, whether it's at the national level or whether it's here in Oklahoma. It seems to be the model seems to be rapidly changing. Talk to the viewers a little bit about that. What do you see?
Well, I see a lot of penny wise and pound foolish behavior, which has reduced access. Cutting rates for whether it's Medicare or Medicaid has reduced access, specifically impacting our rural communities. What that does to us is it forces patients from rural Oklahoma into the metro for care, which I mentioned earlier. We're 110% occupied today. I would venture to guess, and it's a pretty safe guess, that a significant number of the patients at OU Medical Center or Children's today could be in a community hospital somewhere else. But those hospitals either aren't there or the providers aren't there, or they got too sick to stay in those communities. So I don't think we've really done healthcare reform. We've kind of nibbled around the edges of it. We haven't really talked about what do we need to do to create an infrastructure in the state of Oklahoma to have better health outcomes.
Right.
We've been in the bottom 5 in about every healthcare outcome. Thank God for Mississippi. You know, they tend to always be below us.
Right.
But that's not been a part of the conversation. It's been just about the budget.
So a couple of things I've seen going on. One is more and more of the urban hospitals are building regional facilities or outlying facilities. Are those going to be the new model where for acute care you go to those, and if you need more care they ship you to the main hospital? Or?
I think that is a model. I think that we're kind of what we call a quaternary care center, which is a higher level than tertiary, which maybe a Baptist or a Mercy provides. But it's a secondary level of care that can occur in rural Oklahoma is really necessary because a lot of health care needs to be and should be local for people's lives. It's easier. I think it keeps costs down because people don't get sick and stay sick if they get care quick. So I think we need to have evenly distributed healthcare assets across the state. Now, you don't need certain technologies in Enid, maybe, but they certainly need a vibrant healthcare community.
Right. You know, we've talked from an economic development standpoint of the State Chamber, we've talked about the fact that it's very hard to recruit businesses to rural areas if there's no health care available for their employees. It appears that many rural hospitals are struggling right now. What do you see the future there?
I think we're at a crisis point, and as I mentioned, those patients end up coming here sicker. The biggest concern for me recently has been the lack of access for obstetric services, because some hospitals have closed, so other hospitals have just closed their obstetric program, which is a high-risk program from a liability perspective. And so those moms still get pregnant in rural Oklahoma, but they don't get access to care. And they show up at the Children's Hospital where we deliver about 4,000 babies a year, 26 weeks pregnant, ready to deliver, and the baby stays in our neonatal ICU for 7 weeks, when it could have been a full-term baby if they had better access. So that the rural healthcare problem, the other problem is access to providers. They can't get doctors or nurses to be in rural communities. And I grew up in West Texas. It's a little bit of a soft spot in my heart for rural Oklahoma because it's a lot like where I grew up. And you want to see them have basic services in place, whether it's healthcare or education or just other services to provide the communities.
So what do you think the answer is?
I think we need to step back and look at what do we want to become? Do we want to stay in the bottom 5? I think how we can improve access has to be center to the answer, which means incentives for providers to be in rural communities to offer primary care to all patients. I think that's the biggest, is access is the key, and proper payment for access has to occur as well.
So last year, the Supreme Court ruled that there was an option to pass a cigarette tax, which a lot of that money, if not all of it, would have gone to health care. What would that have done?
Well, it would have stabilized the Medicaid program. 70% of children in Children's Hospital today are on Medicaid, and those children don't have the ability to go get a job and buy an insurance policy. So we have to stabilize Medicaid and not only stabilize, look at where we can make it better, because it was what attracts physicians to practice, in this case, pediatric specialties. They're going to have to practice it to Medicaid population. We have to have proper Medicaid funding to do that.
I know we have a physician's manpower training program to try to recruit doctors into rural areas of the state. Do you think that's going to be long-term successful?
Only if we can train more doctors in the state. We're a net importer of physician talent now. There are not enough residents and fellows trained by OU or OSU or some of the other programs in the state to satisfy our demands, especially as the population ages. So I think it will help, but we have to look at our GME programs, our graduate medical education programs, and how we can expand those. So we're training more doctors in Oklahoma. The statistics show if a doctor trains in Oklahoma or Texas, they're going to stay where they train most of the time. And so it's hard to pull them away if they're trained somewhere else.
So the Supreme Court, legislature passed the cigarette tax, among other measures, and the Supreme Court said they had done it improperly. It was unconstitutional as provided. What happens next?
We have to look beyond a short-term fix. The last couple of years, the legislature has put a Band-Aid on the problem and not engaged, in this case, the healthcare community on what needs to be the solution. My colleagues and I stand ready to be engaged on the solution, but it's got to be a longer-term solution than one legislative cycle.
Right. So let's talk a little bit on the national scene. What does the talk of the repeal of ACA impact your business? Sure.
Not as much as if we would have expanded Medicaid. Our state did not expand Medicaid to cover more people as others would, but it affects our business because it eliminates that option for us down the road. That window was already closing. But the ACA, was demonized in our state because of its connection to our prior president. There are a lot of good parts of the ACA, a lot of things it didn't do. Funding more people, giving more people insurance options is a good thing. How the ACA did it may not have been perfect, but to throw the baby out with the bathwater was a bad idea.
Right. I think a lot of Republicans are finding out they don't want to discard all of it.
That's right.
So
especially the governors in those Republican states, right?
That's right. So you've had some organizational issues with OU Medical Center. Talk a little bit about that and what's going to happen. What do you think is going to happen in the future?
We have been, for the last 19 years, it'll be 20, or would have been 20 in February, a partnership with HCA out of Nashville, Tennessee, and the University Hospital Authority and Trust to jointly manage the hospitals under the OU moniker, OU Medicine. It's been a wildly successful venture from a growth perspective, from a financial stability perspective. But at the end of the day, we had an outside entity in Nashville really calling the shots. And at the end of the day, dollars generated by OU Medicine did leave the state and go to Nashville. And I think as we looked at that issue continuing to occur and looked at some unalignment of priorities between HCA and the local university leaders, it made sense to pull it back into a locally owned and operated nonprofit 501c3 health system, which will take over operations on January 1st. Local community board with representatives that are appointed by the governor, appointed by the university, and from the community at large. It'll be among the 3 largest local nonprofit health systems in the state, with Integris and St. Francis, the other 2. But it gives decisions that are going to be made for OU Medicine are going to be made by people that are going to be served by OU Medicine, that are in the community, that we're taking care of patients in.
And you're going to be the CEO of the new entity.
Oh, at least at this point.
All right. We need to take another break, and we'll come back with our discussion with Chuck Spicer. Hope you'll join us. Welcome back to our discussion with Chuck Spicer, the CEO of OU Medical System. Chuck, this change is going to go into effect January 1st for the center. What does it mean to the Oklahoma City from an economic standpoint?
A lot of corporate services that were provided by HCA that were based in Nashville or Houston or Dallas will have to stand up here to provide those services. So that means over 300 new employees, which is about a $200 million annual impact when you look at the multiplier of that. But the most exciting thing, maybe other than the new company itself, is we broke ground on a new expansion of OU Medical Center to open more operating rooms and beds, over a $300 million expansion project, which is one of the largest in the history of the state for healthcare. So that'll allow us to serve more people. We know we are still diverting people out of the state because we don't have enough beds to take care of people with the most complex disease processes. So very exciting for us. It's something we desperately need and will very much help the state.
How does, I know just enough about this to be dangerous, but I know that there are big university-owned facilities like in Alabama and other states. How does OU compare to some of those states?
It's a great question. I think we've done a lot of a comparison to those universities that are specifically state-affiliated hospitals, not necessarily state-owned, or just university affiliated like Vanderbilt or IU in Indianapolis, UAB in Birmingham. And I think we're getting there. We're not there. Our children's hospital is probably 80% of the size of like a Riley Children's, 75–80% of Riley Children's in Indianapolis, and they're a top 25 children's hospital. You know, we're getting into the zip code, but we're not there yet. Our cancer programs are rapidly getting there. We are 3rd in the country in clinical trials for certain elements of cancer now, which is pretty impressive. The work that's been done at Stevenson Cancer Center under Dr. Robert Mantle has been incredibly impressive. And I think we're just on the growth curve now. We're just on the beginning of it. But we're not, I don't think we were, as much as we've done that we can be proud of, we're not where we want to be.
Right.
And we want to be comparable to the Vanderbilts and the IUs and the Michigans, and you know, maybe someday we can compare ourselves to the Texas Medical Center down in Houston, which is an extreme stretch goal.
Right.
But that's what the founders of the Oklahoma Health Center had in mind when they went down to Texas, 50 years ago.
And the result of that is that people from all over the country go into those centers. So they bring dollars, they bring patient dollars to the state, to your state.
And research dollars.
And research dollars.
Research dollars, patient dollars, high earning jobs. We recruited a cardiac surgeon from the Mayo Clinic, Dr. Harold Burkhart. Dr. Burkhart could have gone anywhere in the country. He came here because he wanted to raise his kids in the Midwest. And that's been a huge economic impact to keep more families in the state, but also you have a high earning physician that's in the state that's going to raise his family and spend his tax dollars in the state.
Right, right. Well, let's switch gears. You have, explain what the Live to Give volunteer program is.
Well, the Live to Give volunteer program is really a program to energize volunteerism among OU Medicine. This is not just the hospitals, but OU physicians and the Health Science Center campus. Get their involvement in local nonprofits or local charitable activities, whether it's Habitat for Humanity or the food bank. We have a lot of nonprofits that operate kind of around the Health Science Center, Ronald McDonald House, Cabot Kids Foundation. And it just it lines up those opportunities for our employees. Really, a lot of credit goes to OU physicians who really drove that program that now benefits the entire campus. And we did things with a tornado in 2013, cleanups of fields, going to help with the dog shelter that was overwhelmed. So it's just, it's a way for me to get on the line with an employee and volunteer, and we're working together. And it may not be someone I see my
Right.
normal job.
Right.
They probably don't want to see me.
No, that's, it is interesting when you can find those opportunities to work at a different job with one of your employees, because I mean, to a lot of your employees, you're probably the guy who's in the office they never see, or
Right.
that. So it probably gives you a real chance to relate to your own employees. But you had an employee who was just honored.
Danny Cabot, we talked about Cabot Kids Foundation just a minute ago. Danny Cabot has been a longtime chaplain, is now the head of pastoral care for the hospital system. A fantastic human being, is the epitome of what I think I would want to do to give back to the community. And Danny did it by creating a camp for kids that have struggled with different diseases or disabilities, more than 20 years ago. And the camp has turned in and touched thousands of lives. And Danny was honored by the Oklahoma Center for Nonprofits last night, and we're really proud of him.
All right. Well, congratulations to him and to you for encouraging that kind of volunteer activity. So we need to take another break, and we'll come back with some final questions and thoughts with our guest, Chuck Spicer. Come back and join us. There we go. Welcome back to our visit with Chuck Spicer. Chuck, you're also a part of the Innovation District here in Oklahoma City. So talk about that, the connection between, I know for many years people have wanted to have a connection between the downtown area and the Health Science Center area. How do you see that developing over the next few years?
Well, what's happened in the last 15, and certainly since I've been here almost 13, has been incredible. When I first arrived to interview at OU Medical Center in 2004, it wasn't necessarily an inviting place to drive up to around the campus, but the GE headquarters, the OMRF expansion, what we've done on the campus itself, the Embassy Suites, now the Innovation District is really exciting. That urban living options that are even now south of the campus, it's really built a bridge from downtown to the Health Science Center campus of the Oklahoma Health Center. That nice beacon of hope that the foundation put in years ago is really now the wonderful gateway as you cross over 235. But I think we're just scratching the surface. We looked at some old pictures recently to look at the campus in 1997 and the campus in 2017, and it looks like you're going 100 years.
Right.
And the exciting thing is now we've just started a new hospital building. We plan on more expansion to attract better clinical care and research going on our campus. And I just don't know what it'll look like in 20 years. I can't wait to see.
Yeah, it actually, last time I was there, it looks more like a campus. At one time it was just sort of a collection of buildings. It's now looks very much like a campus, and my understanding is there's a lot of housing development coming down the pike, and so the future looks really bright for that area of the city.
I hope so. I think, that it's the architectural crown jewels of the city now. The Children's Hospital is a beautiful, beautiful building that makes kids feel good when they come in, and when otherwise they don't feel so good. But it's a bright, cheery place, and I think the whole campus is taken on that same spirit.
So with the new venture taking effect in January, expand out 5 years. What does it look like? What would you like to see happen?
I think will reset our ability to form different relationships with other healthcare providers in different parts of the state and community. I think it frees us up from someone in Nashville dictating that, so it gives us a lot more flexibility. I think you'll see a broader network. I think you'll see an NCI designated cancer center, the only one in the state. I think you'll see continued growth of programs that no one else can deliver, the largest arsenal of cancer treatment tools. I hope you see 30 or 40 more pediatric specialists because we have that type of demand and need that no one else can provide in the state. I hope you'll see a much more user-friendly place for people to, we're in an intimidating place to talk about the campus. It's intimidating if you're coming from Guyman, right? So I want it to be user-friendly, whether it's on the internet or using a computer or when you're actually in the building. So I think it's a time to dream, and it's a really exciting time for us.
All right. Well, so one final question. What's your message to the legislature for this next legislative session?
Develop long-term solutions to better improve healthcare access and outcomes in our state.
All right. All right. Well, thank you, Chuck, for being here today, and we'll look forward to the new entity, and I'll look forward to seeing you in the neighborhood as well. So good to see you. And thanks for being with us today, and we hope you'll see you next time as we continue to talk about business stories in Oklahoma.
Thank you for watching the State Chamber of Oklahoma's Business Roundtable, presented by Cox Communications. If you have questions about this program, email the Chamber at okstatechamber.com. Set furnishings provided by Scott Rice, creating effective workspace from the floor to the ceiling and everything in between.